Hello, I'm Dr. Sai. Have you or a member of your family been diagnosed with inflammatory bowel disease, or IBD for short? If you have, you're not alone. Some 3 million people suffer from IBD in Europe. IBD is the chronic inflammation of the bowel and usually strikes when you're in your mid-teens to your 30s. But it also affects people older than this and can even appear in young toddlers. Treating IBD costs our healthcare systems more than €5 billion a year. Symptoms include abdominal pain, nausea, diarrhea, bleeding, extreme tiredness, and unintended weight loss. We don't know for sure what causes IBD, but it seems that our Western lifestyle, together with other environmental factors such as smoking and possibly diet, are changing the way our guts behave. And if someone in your family has IBD, that also increases the chance of you getting the disease. There are 2 types of IBD: Crohn's disease, which affects the whole of your intestine, and ulcerative colitis, which only affects the large bowel or colon and is usually less painful. Whichever type of IBD you have, there will be times when it flares up, but also times when you're feeling much better. After running some tests, which may include taking blood, an X-ray or a colonoscopy, the doctor will then decide on a course of treatment for you. This could include anti-inflammatory tablets, medical steroids, or in more severe cases, injectable biologic drugs, which suppress your immune response. 40% of sufferers will need surgery at some stage. Some very clever mathematicians and computer experts have been added to the mix, and together the team has analysed the data from many hundreds of IBD patients across Europe. The results have meant that they have been able to split sufferers into different patient types or groups, information which will help your doctor or IBD consultant to identify which treatment is more likely to be effective for you. The research undertaken in SysmedIBD has made some very exciting progress. A new diagnostic tool can identify a group of patients which show a strong response in cell culture compared to controls. And a well-known drug used for some time for the treatment of other diseases has shown very promising lab test results, and after more research may be used for a subgroup of IBD sufferers. If you have been diagnosed with IBD, it really is important to know that you're not alone, and that there are many people out there trying to find ways to make your life that little bit easier. We've filmed some of our experts telling us more about the SysmedIBD project, so if you would like to know more, please visit the project website.